Center of Community Medicine has been a key department at AIIMS New Delhi. It has been a center for training of students and research for community problems. The main focus area has been development of a model of comprehensive health services through its urban and rural health programs. The urban health program provides community-based health services to an urban resettlement colony in Dakshinpuri Extension and the rural program as Comprehensive Rural Health Services Project (CRHSP), established in Ballabgarh, Haryana. CRHSP Ballabgarh is a collaborative project between the Haryana state government and AIIMS. It was started in 1961 with the aid of Rockefeller Foundation, primarily as an academic and health delivery setup. It comprises of a sub-district hospital at Ballabgarh and two primary health centers at Dayalpur and Chesa. Sub-district hospital is located 35 kilometers away from AIIMS New Delhi. It is well connected by National Highway 2, called as Mathura-Delhi Highway, and the Delhi Metro. It is 300 meters away from the nearest metro station, Raja Nehar Singh, on the Violet Line. Let's take a tour of the sub-district hospital, Ballabgarh. This hospital has several services like outpatient and inpatient department, emergency, surgical, laboratory, medico-social, counseling and radiological services. Here is our registration counter. Last year, we catered to 3.5 lakh patients at our OPD. Here we have the magnificent Rani Ki Chhatri, constructed by the widow of Jat ruler Anirudh Singh in the memory of her deceased husband who ruled Ballabgarh till 1818. More than 13 departments from AIIMS New Delhi collaborate to provide healthcare services here. We have daily OPD for general medicine, general surgery, obstetrics and gynecology, pediatrics, orthopedics, psychiatry, dentistry, immunization clinics, Ayush and homeopathy. Special clinics are held once to thrice per week for neurology, ophthalmology, antenatal clinic, ENT, dermatology, plastic surgery, PMR, pediatric surgery, non-communicable disease clinic and nutrition clinic. Tuesday afternoons, we have outreach specialty OPD or ORSO involving 4 specialties of obstetrics and gynecology, pediatrics, ophthalmology and psychiatry. And these services are provided at our primary health centers, which receive referred cases from our intensive field practice areas. Opposite to the OPD building is the birth and death registration room and the immunization clinic. Next to it is the pharmacy, where essential medicines are provided free of cost to patients. Here is our lab. Last year, more than 2.6 lakh investigations were done. This hospital is a 50-bedded hospital with a bed occupancy rate of 118%. The ward is managed by interns and community medicine JRs under supervision of SRs from respective clinical disciplines. Attached to the ward is the antenatal room and labour room. Last year, 3,754 deliveries were conducted. Next to it is our operation theatre, where more than 2,000 procedures were performed, mostly including surgeries for cesarean deliveries, cataract, hernia, etc. Sub-District Hospital Ballabgarh is a tuberculosis unit under the revised National Tuberculosis Control Program. 3 designated microscopic centers are attached to this unit. heading towards the emergency, which is having availability of a 24/7 ambulance service. It is managed by 5 to 6 medical officers from State Government of Haryana. It is 10-bedded and functions 24/7. There were 66,540 registrations last year. Here is a spectacular view of the administration building, which harbors the team behind this Herculean effort needed to run this setup of comprehensive rural health services project. This is the bustling residential area for nursing students, MBBS students, interns, JRs, SRs and faculty. Ballabgarh posting for undergraduate students began in the year 1972, with residential posting initiated in the year 1982. There is library and 24/7 reading room available on the campus. For sports lovers, we have a dedicated table tennis room and a badminton court, and a 24/7 available gym for the residents. This is the hostel mess with mouth-watering dishes and television complementing it. CRHSP Ballabgarh provides community health services to intensive field practice area of 28 villages through a network of 2 primary health centers, Dayalpur and Chesa, consisting of a total of 12 sub-centers. Both the PHCs work in direct coordination with the District Health Department of Faridabad. We have fully computerized health management information system since the year 1991 for our intensive field practice area, which now has a total population of more than 110,000. Let's move to PHC Dayalpur, which is located 10 kilometers from here. In 1965, it was a mini center under Ballabgarh PHC, but now Dayalpur functions as a PHC under CRHSP Ballabgarh. On the right is one of the 6 sub-centers of Dayalpur. The outreach clinics are organized frequently at the sub-centers. PHC Dayalpur caters to a population of more than 50,000. It provides outpatient, inpatient and referral services. In front is the herbal garden, which harbors 50 to 20 varieties of medicinal plants. At the entrance of the main building is the Ayush OPD, run by a medical officer appointed by the Haryana government. This is our OPD run by interns and junior residents. PHC Dayalpur is a designated microscopy center under RNTCP. Straight and to the right is the parking. To the left is 24 hours available emergency room, which has an ambulance service. PHC Dayalpur has a 6-bedded ward. To the left is a delivery hut. This is the hostel for residents. At the front is the badminton court, and at the back of the hostel is a vast lawn for recreational activities. Let's now go to PHC Chesa, which is 10 kilometers from PHC Dayalpur. On the left is the parking space for the ambulance. It caters to 50,000 population. PHC Chesa covers 11 villages through 6 sub-centers. At the sub-center, extended health clinics are organized weekly. This is the patient waiting area and the registration counter on the right. It has an emergency room, dressing and injection room, ice-lined refrigerator room, storeroom, pharmacy and laboratory. On the right is a daily OPD run by interns, junior residents, and the weekly specialty clinics or so. It provides 24/7 delivery, referral, and emergency services. We have 6-bedded ward. Now heading towards the hostel. Towards the left is the badminton court and the quarters for the staff. Here comes Happy, our hostel watchkeeper. There is a TT room. This is our hostel mess for residents. Opposite the hostel is a lush green lawn with a volleyball court. Quite often, you can spot a peacock strolling in the campus. We have successfully demonstrated translation of community-based research to policy and to program, and produced several stalwarts in public health. We aim to develop a model of comprehensive healthcare replicable at a national level and to conduct research addressing national health priorities.